Yo, yo, everybody. What is up? It is a very cold day here in the Tampa Bay area. If you are new to following me, I am a physical therapist in Tampa. I got what I call the Outfield Everything Clinic, and I've learned to get exceptional results. And I've been teaching and sharing those methods for the better part of a decade. And today I am talking about sciatica that was and wasn't. Okay, so I have three patients right now, three patients that came to me and they had, I've had true sciatica. They had pain down their leg, right into their foot, right? They have a herniated disc on the MRI, and that confirmed that that's what this was a herniated disc, right? So all three patients came in here and told me that this is why I have pain in my leg. Okay? Now, in my mind, I am sitting there and I'm like, not too sure. And the reason why is because one of the first things I ask someone with radiculopathy is, does it go into the toes? Okay? The toes, the actual toes. And they like to talk about the foot. I'm like, no, not the foot, toes. Because SI joint dysfunction, I have found in my patients, can cause foot drop. I have that I documented that in my SI joint paper, and it's been documented rarely in medical history, into the top of the foot, but it does not go into the toes. Okay? So I ask them about the toes. If they say it goes into the toes, I'm like, okay, well, we have most likely a true case. I've only seen a couple cases where I open up their SI joint and their toe, that happened the other day actually, the toe numbness, tingling, pain went away. Which I'm not too sure if it was truly SI joint or just an irritated nerve from me, unirritated, if you will, from me realigning it. And so I asked them, does it go into the toes? Yes, it does. Also in my leg, right? And you do the slump test, but you can't rely on the slump test, because a lot of times people with the slump test, if you realign their SI joint using my SI joint method, like I've found, like the slump test turns negative, especially if they're pointing to their actual SI joint. If they're pointing to their SI joint, then they're shearing it when you do the slump test, right? You go like this, and they have SI joint. You're just shearing their SI joint, and then the person says, "Oh yeah, my back hurts," right? Shearing SI joint dysfunction, and the person says, "My back hurts," and the reason why their back hurts is because you just shear their SI joint. You realign their SI joint, and then that turns into negative sometimes, I've found. So in these three patients, they came in lit up like a Christmas tree, okay? All the way down their leg, but into the toes, right? So, Inak, can you come here for a second? I'm gonna show you what I did with these patients. So, everybody knows Inet, the Vanna White of physical therapy. Okay, so face that way for me, please. Let's see if people can see me. Okay, so I palpate the PSIS, okay, and those are the knobs. Some people have trouble palpating. It's the knobs where your thumbs flop on and off, okay? Palpate the PSIS. I have her arch back for me, please. Okay, so in an SI joint patient that has an upslip, I propose in my paper that made medical history, read it, in readership, is that one thumb translates superiorly. And when one thumb translates superiorly, then the person has an upslip. Okay, so let's say she has this translated superior. So lay on your back for me, please. So she has an upslip on the left side. You have to get the upslip first before anything else. This diagnostic procedure will not work that I developed. Now, I say, have you ever had hip surgery? And they say, no, great. If they say yes, I'm not pulling on their leg. I pull on their alar. I won't pull on their leg because you'll send the person to the emergency room, okay, if they've had a total hip replacement. So I grab under here. This is where I pull from. Don't pull from here, you hurt their knee. Grab under here, I say relax, okay? And you want the person to slide on the mat. I usually do it like 3, 4, 5 times, okay? And then I say, go ahead and stand up for me, please. And I say, stand up for me, please. And I say, arch back. Okay, great. Both of my thumbs are now dropping, translating inferiorly, which means I got the upslip, okay? Now, if they didn't drop, then you need to pull harder, okay? Now, I say, now in my root cause of SI joint dysfunction paper, okay, that's the name of it, that statistically made medical history and readership, click the school group below, join my free school group. I have it posted right there with all kinds of videos on how to help people and get, you know, results that all these people are posting about getting crazy results in that group, okay? So the next thing you do after that is I realign the out flares, okay? So lay on your side, face me, I take a Hydroc pad, okay? I take a Hydroc pad because this is tender on everybody, and I say, I'm gonna push on the on your hip. You just let me know if it's too much. I am pushing on the ASIS medially, and I'm gapping open the out flare. Now I'll do this for like 30 seconds, but you gotta watch their face because this is tender on everybody, and sometimes it's just too much for the person. So you just try to move around and find a place that it doesn't hurt, okay? So I gap it open. Let's say that was 30 seconds, right? And I do it on both sides. And then I say stand up, okay? And I say, you know, let's say her aggravating motion was extension, which it usually is with SI, but it can be flexion. I say arch back, is that pain still there? And if they say yes, like my last eval, then what I do is I go like this. I hug, what I was doing on the mat, I push medial on the ASIS like this, and I hug like that, okay? Like that, and I push up here, okay? And I say hold, okay? And I hold it there. And I say, okay, now I have them arch back or whatever the aggravating motion was, arch back. Okay, is it still there? No, not my back. But if they have radiculopathy, okay? If they have radiculopathy, I ask them, while I hold it open, you can use a ball too, have them squeeze, that helps with the out flare gapping. Adductors open up the out flares biomechanically. And what I do is I hold and I say, do you still feel that in your leg? Okay. And they'll say, if it's from SI joint, they'll say no. And then these 3 particular cases that I'm talking about is they had the whole leg was lit up into their toes. And all of their leg pain went away, except for their toes when I opened up their sacroiliac joints, okay? And I held it open. They were like, yeah, no, this is gone. And then I say, is it still in your toes, okay? I say, is it still in your toes? And they say, if they say yes, okay, great. So this area, this whole thing, minus the toes, was actually SI joint, despite an MRI showing an L5-S1 herniation and what you would think a typical, you know, radiculopathy patient would look like, right? So these 3 patients, and I like that better because sciatica can be finicky. I can usually help it, but sciatica can be finicky. The SI joint dysfunction is a mechanical issue. If you know what you're doing, you can realign it, you know, and stabilize it, you know. I do all day. I've been basically a low bit chronic upfilled everything clinic, and it's usually this all day long. And then I check their sacrum. We'll talk about it in another video. But in these 3 cases, these people were lit up like Christmas trees. All of it went away but the toes. Okay, and that means that this was SI joint dysfunction. This was true sciatica. Okay, thank you, Annette. All right, so you need to remember, you need to get the up slip first, okay? So it's slipped up. You need to pull in the leg, bring it down. Got to get that first. If you don't get that first, what happens is that the person still has out flares like that, okay? And I propose in the paper, it's caused by an upslip and or out flare. I rarely see just an upslip in here. But if you try to open up an out flare with the person with an upslip, you're just jamming this jagged edges further, okay? So you need to pull in the leg first, get that, okay? Negative prone press up test, and then open up the out flares, and then you usually need to hold it. Now, my last eval had this groin weakness. The guy drove 3 hours to get here because no one's been able to help him. He's got this back pain and groin pain, and the groin pain, he said, only hurts when he squats down. So I held, like I just showed you, I held his ASIS medial and I said, squat down. And I held it while he squatted down, like that. And I said, is that still there in the groin? No, no one's been able to figure it out. Like that, there was SI joint. And he's like, man, it's crazy. I had to drive 3 hours, you know? And I'm like, I'm trying to get this out to the world, man, but you know, it's a big medical system. So anyways, what people know about me is that I'm this like clinical expert guy that teaches online, right? But what people, and you can join my free school group right here, posted below, or go to weltonmethods.com and say, drop down menu, join my school group. What people don't know about me is for years, people were asking me when I traveled and taught live, for years, people were asking me, hey, Ryan, will you teach me how to open and run that cash-based clinic you have in Tampa? My clinical students would ask me. And for a while, I was like, nah, I'm not really interested. And, but then I started thinking, I got this chronic pain clinic where like I'm the personal last resort for most of these people, I would say, they tell me that. In like last week, I had 4 patients cry and a husband because I diagnosed them with SI joint dysfunction. I got them out of pain, diagnosed them with SI joint dysfunction, and they just were stunned. They couldn't believe it after years, decades of suffering. And one lady has a spinal cord stimulator in her back, and she is out of pain, boom, immediately. It was this that was causing her pain. That's how I opened it up, and her pain relief, so that was causing her pain, right? But what people don't know about me is that I teach people how to open and run an extraordinarily powerful, profitable, successful cash-based clinic. Very different than everybody else teaches it, okay? Like usual with me. So what I find is that physical therapists or chiropractors, whatever, we come from the heart, okay? We are not natural salespeople. We are not, you know, we came in to help people, but people want to be successful in business and live life on their terms, right? So I don't do sales techniques. If you are watching this, and you want to open up a cash-based clinic, and you are not a natural salesperson like I am not, then this is what I do. I relieve their pain. I get them out of pain, no fancy sales techniques, and then I just show them what it costs. And my patients, my students charge, the goal for them is $400 for 30 minutes, okay? And people are like, oh, nobody's going to pay that. Everybody wants to pay insurance. No, 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 no. These people that have these chronic pain conditions are desperate for someone that has invested their time in education to be able to understand what's wrong with them. And they are not, that's like, most of my patients have spent $20,000 to $120,000, they tell me, in that room, that evaluation room. So for me to charge what I charge is like a joke for them, you know? So, but I actually showed them I know what I'm doing by getting them out of pain, show them what happened. It was mechanical, blah, 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 blah. Okay, so now you cannot be successful in business in a cash-based clinic unless you know what you're doing clinically. So to my knowledge, I am the only one that I see that teaches the clinical part of it as well. Like my papers that made medical history statistically and readership that are pinned right there to my social media. Getting multiple times, even New England Journal of Medicine and Lancet, according to AI, annually, year after year after year, they've gone viral. And I use my clinical courses, my protocols, to demonstrate to the patients that I actually know what I'm doing, not some fancy sales techniques where I manipulate. Eventually, you have to deliver, okay? You cannot sit there and manipulate people with fancy sales and marketing tactics unless you're going to deliver, okay? I see cash-based coaches telling people stop taking clinical courses. I'm like, Dude, that's what the patient's coming to you for. I get what you're saying. You want people to focus on business, but I'm going to teach you both. Okay, I teach my students the business part from nuts and bolts, how to open, run a business, marketing, accounting, all of it, targeting. I give you my marketing company, everything, and then I teach you how to the clinical part, and I also teach you how to talk to patients. One of the most important things is how you talk to patients. People are like, oh, I know how to talk to patients. No, because I didn't. And in business, it'll make or break you, the words you use to communicate what you're trying to communicate. If you communicate it wrong, or in a way that can sound, oh, I don't know how to put it, in a way that the patient gets turned off by it, versus communicate that what you're trying to communicate, that, no, I know what's wrong with you. And here's how I know what's wrong with you. And I have all these ways of doing that took me 20 or 17 years, 21 years in practice, 17 years in a cash-based clinic to be able to develop these. And to me, they're as powerful as my clinical methods that everybody loves. So join my free school group below, and I am teaching and talking more about it in this extraordinarily profitable cash-based business model that I developed based on chronic pain, based off my methods. So it just takes the guesswork out of it type thing. And I work with people, weekly on their clinical and business skills. Okay. Other than that, I love you all. Peace out.